I was a medical student, the neuroanatomy exam question 2 years in a row was the ventral aspect of the brainstem and its blood supply. We were shown bewildering diagrams such as these with complex structures, strange names, pathways going everywhere, and of course we all learnt it off rote without any clear understanding of what it meant. Over the years, as I began to see patients with brainstem strokes, I realised that in fact they fell into two broad categories. Those that affected the lateral aspect of the brainstem, supplied by the large circumferential arteries such as the posterior inferior cerebellar artery, the anterior inferior cerebellar artery, and the superior cerebellar artery, and strokes from the medial aspect of the brainstem that were supplied by small perforating vessels that came off the distal vertebral and basilar arteries. When I further looked at the brainstem, it was clear that there were midline structures and lateral structures. And in 1985, I devised the rule of 4 of the brainstem. It helps people understand brainstem stroke syndromes. In essence, the brainstem consists of the medulla, the pons, and the midbrain. And the first rule of 4 is that there are 4 cranial nerves in the medulla, the bottom 4, 9, 10, 11 and 12. There are 4 in the pons, 5, 6, 7 and 8. And there are 4 above the pons, with 3 and 4 in the midbrain and 1 and 2 outside the brainstem. The second rule of 4 is that there are 4 structures in the midline beginning with the letter M. From the back of the brainstem forwards, they consist of the motor nucleus, the median longitudinal fasciculus, the medial lemniscus, and the motor pathway. It is usually called the corticospinal tract, but I've called it the motor pathway because then you can remember that there are 4 structures near the midline beginning with the letter M. In the lateral aspect of the brainstem, there are 4 structures beginning with the letter S. The spinocerebellar pathway, the spinothalamic pathway, the sensory nucleus of the 5th, and the sympathetic pathway. The final rule of 4 is that the 4 motor nuclei are those that divide evenly into 12, except for 1 and 2. Therefore, the 4 motor nuclei are 3, 4, 6, and 12. If you regard the 4 M's and the 4 S's as meridians of longitude, and you use the cranial nerves that are in the particular level of the brainstem, you can accurately localise all patients with brainstem syndromes.